morning. My name is Amy McNeil, and today I'm going to be bringing awareness to delirium. The purpose of this presentation is to bring awareness to delirium as well as proper education and training. What is delirium? Delirium is a serious medical condition. It changes the way a person thinks. It also reduces the awareness of a person's environment. Delirium usually starts off fast, usually after a medication or anesthesia. Delirium affects almost anyone, but more common, a patient over 70. What are the causes of delirium? Well, I found an acronym that will help us determine the causes of delirium. D, dementia. E stands for electrolytes. L stands for lung and liver. I, infection. R, RX. I, injury. U, unfamiliar environment. And M, metabolic. The objective of this presentation is to bring awareness. We want to introduce educational classes. We also want to introduce protocols and procedures so we can reduce the number of cases and prevent the syndrome altogether. I chose this project on the fact that there is a need to bring awareness to this syndrome. Delirium is more common in serious syndrome than we all can even think of. My PICO question that I chose is, how does having a specialized protocol concerning patients with delirium affect the patient's healthcare outcomes in preventing or reducing the number of cases of this syndrome? Like with anything, it's going to take an intense training and education so we can bring awareness to this syndrome. Seminars can be held so we can bring the proper education needed so we can identify this syndrome. We want to improve the patient's outcome. There is an innovative strategy that we use, and it is called HELP. It's Hospital Elder Life Program. This program, we would like to decrease in the hospital mortality rate, which is currently at 27 to 76%. We need to decrease that immediately. We would also like to decrease the hospitalization rate, which right now is at 49%. Also, delirium causes hospitals to spend over $80 billion. That needs to be decreased. A lot of physicians and nurses cannot recognize the symptoms of delirium. As of right now, we're at 32 to 40 to 66% on physicians and 69% on nurses. How can we prevent delirium? Well, we can maintain an active lifestyle. Not only that, but we can get family involved. We can encourage adequate sleep and nutrition and hydration. Hydration is key. Also, a calming environment is a must. We can also medicate the patient accordingly with pain medication or agitation, as well as the usage of proper sensory enhancing devices such as a hearing aid. As a nurse, my personal responsibility is to provide the best quality of care that I can. I would like to maintain an open rapport with all healthcare providers. We all need to be on the same page. Also, as a nurse, I would like to promote rehabilitation and to enhance sensory function. It is going to take intense training, but we can do this. Evaluation of this project is crucial in determining if this project is a success or a failure. Evaluations need to be made based on the number of cases. Nurses and other healthcare providers work together to reduce this cause. The expected outcome of this project is to include education classes and introduce to many healthcare facilities as possible. We need to decrease the number of cases of delirium. Nurses and other healthcare workers being certified in order to better equip determining the causes of delirium. We also need to use yearly seminars as well. Education is the #1 way of preventing any kind of syndrome, along with delirium. We need to reduce the number of cases of delirium. Protocols and procedures need to be implemented in all healthcare facilities. Thank you.